Hola, I am Dr. Pilar Ortega, and it is my pleasure to welcome all of you to the 5th Annual MOLA Latino Health Symposium. I am one of the co-founders for the Medical Organization for Latino Advancement, MOLA, and I am an emergency physician and clinical assistant professor at the University of Illinois College of Medicine. Currently, I am serving as immediate past president and co-chair of the Education and Research Committee, together with an amazing and talented team including co-chair and public health expert Ariel Guzman, our medical student leader Rafael Ramos, and our intern Maria Alejandra Cañas. The MOLA Education and Research Committee is charged with developing and executing our annual Latino Health Symposium, which is our biggest event of the year. As you will see throughout the symposium, this leadership team represents only a fraction of the many volunteers who make this event possible and for whom we are extremely grateful. The purpose of this short presentation is to go over two main things. First, the theme and learning objectives of the symposium, and second, to help you identify how you can participate in MOLA during and beyond the symposium. This year, we have chosen the theme, the healing power of our identity, el poder sanador de nuestra identidad. And I want to take a moment to explain the significance of this theme and share our conference objectives with all of you. Over the past year or so, during a time in which the entire world has been so deeply affected by the COVID-19 pandemic, society has been exploring the concept of identity in new ways. As a community, I have noticed that many individuals in my own Hispanic Latino network have been analyzing, and I think sometimes battling, sometimes celebrating, the many complex aspects of who we are. We know that sometimes people are mistreated due to race, ethnicity, language, culture, gender, income, immigration status, or other factors that might make our identities feel rejected. Maybe there is a new glimmer of hope in that as a society, perhaps we are more willing to call out those instances of mistreatment rather than play the game as it has always been played. MOLA represents an organization that was literally founded because we needed to rewrite the rules of the game. MOLA is our collective opportunity to stand up proudly for who we are as a community, but also for who we are as unique individuals, our personal identities in every aspect of our lives, including our professional work. This is an area that intersectionality is very close to my own heart as someone who identifies as a Hispanic, bilingual, Spanish and English speaking woman, because the core of my own academic work is about improving patient-centered communication with linguistically diverse populations. For me, and for the growing MOLA membership, MOLA is truly a unique space where together we can break down the artificial barriers that too often systems, institutions, or individuals in positions of power may place on us. MOLA connects professionals across different healthcare fields. MOLA integrates academic medicine and clinical practice. MOLA marries personal passion with professional research goals. MOLA unites students underrepresented in medicine and healthcare with mentors who have paved the way. MOLA is a bridge for collaborators across institutions. MOLA provides opportunities for your career advancement and promotion at every stage. So now that we've talked about why this year's theme is the healing power of identity, el poder sanador de nuestra identidad, let's talk about what we hope you will achieve during this event. At the conclusion of the program, attendees will be able to understand key issues in Hispanic Latino health and health inequities on a local, regional, and national level, including as a result of the COVID-19 pandemic. 2, you should be able to identify evidence-based strategies to address gaps and to implement best practices with respect to Latino health. 3, We would like you to be able to describe innovative academic research, community practice, or educational development opportunities that have the potential to impact Latino health equity. And finally, we hope that you will be able to apply strategies in health policy or health education that address increased equity and Latino representation in medical careers and other areas of health professional advancement. Now let's get to the practical information. How can you participate in MOLA Symposium hoy, mañana y siempre? The annual Latino Health Symposium is one of the key opportunities that MOLA provides for advancing your education and career, and there are 4 main ways to participate. First, show up and speak up. 2, complete the pre and post surveys. 3, support our scholar program, either by applying yourself or by encouraging a student to apply. And 4th, network with us and join our team. Let me explain briefly how to take advantage of each of these 4 opportunities. Like in most endeavors, showing up is one of the most important things you can do to demonstrate your commitment, engagement, and this will in turn pay dividends for your own advancement. In MOLA, we pride ourselves in a sense of warmth and community, even through the virtual space. This is why we have intentionally created our conference in such a way that all participants can see and hear each other rather than using a webinar style. When you join the meeting rooms for any part of the symposium, we strongly encourage you to share your video, participate actively in the chat, and unmute yourself at times when the moderator invites comments from the audience to share your questions and ideas. Queremos promover participación tanto en inglés como en español, so feel free to be bilingual in MOLA's safe space. Since this is a 2-day conference, each day is a little bit different in terms of content and logistics for attendance. Friday, October 8th is our academic poster event. To attend the poster event, you need to visit the link for MOLA's iPosters gallery, where our poster presenters have each displayed their poster. You can listen to their audios to hear them present, and most importantly, please visit the presenters live from 4:30 to 6:30 p.m. Central Time, the same way as you would walk by posters during an in-person conference. To visit the presenter live, click on their poster in the gallery, then click on the video session button on the bottom of the screen, as shown here, and follow the prompts to join their Zoom or WebEx. You can then go back to the gallery and choose another poster presenter to visit. This is really an incredible opportunity to meet and think through potential collaborations with our outstanding poster presenters, the vast majority of whom are students. Please show your support by visiting their video meeting rooms, congratulating them on their work, and asking them questions. Saturday, October 9th, will include the symposium plenaries and breakout tracks. The full agenda can be found on MOLA's website, where you can also access our speaker bios and the abstracts for our oral and poster presenters. The first 2 hours of the event, from 9 a.m. to 11 a.m. Central Time, will be our symposium plenaries with an extraordinary lineup of speakers who are giving their presentations live in the virtual conference. The second half of the Saturday event, from 11 a.m. to 1 p.m., will consist of live breakout tracks. At 11 a.m., you can choose between 2 breakout tracks, A or B, as shown on the screen, and at noon, you will need to choose between a different set of 2 breakout tracks, again in rooms A or B. I can assure you that the only problem you will have will be how you will decide, since all the content will be highly relevant to Hispanic Latino health and to your professional work. The next way to participate in the symposium is to complete our pre and post surveys. We need your feedback and engagement to improve our educational offerings every year. Additionally, we are thrilled that this year our symposium has been accredited for continuing medical education credits by the Chicago Medical Society. Friday's event is accredited for a maximum of 2 hours of credit, and Saturday's activities are accredited for a maximum of 4 hours of credit. So you can claim in total 6 hours of CME. In order to receive your CME certificate, however, attendees have to complete the pre-survey and the post-survey. You can access the pre-survey right now if you'd like by using the QR code on your screen or by clicking on the link that you'll be provided in the email. The post-survey link will be sent after the event. Thirdly, we invite you to apply or invite a student to apply to the Mola Michael Reese Foundation Scholar Program. Thanks to the generous support of the Michael Reese Research and Education Foundation, Mola is proud to once again announce that our application for the Mola Michael Reese Foundation Scholar Program is now live for the 2022 Scholar Cohort. All the instructions to apply are on our website, which you can see on our screen right now. This year's deadline to submit complete application materials, which includes letters of recommendation, is the 20th of December, 2021. This opportunity is much more than a financial scholarship alone, since our scholars are also paired with hand-picked health professional research mentors who guide them through a research project, and then they present at Mola's Symposium. I hope you can join us for the closing ceremony for the 2021 Scholar Cohort, which will take place at the Symposium on Saturday around 1 p.m. Central Time. Hearing from the scholars themselves is better than anything I could tell you about the impact of the program. Finally, I invite each one of you to join us for the social networking portion of the conference on Saturday afternoon to get involved with one of our committees and to get your foot in the door of Mola leadership. I can tell you from personal experience that the more you put into Mola, the more you get back. Muchas gracias y feliz simposio.